Thank you. At this point, we're going to begin public testimony. As I had stated earlier, we invited one panel of expert witnesses to come forward, 2 in favor of the bill, 2 in opposition. I thought that they would be able to lay the groundwork for the rest of our discussions. I'm going to call Amy Hagstrom Miller, Orland Carter Sneed, Dr. Matthew Romberg, and Dr. Mikhail Love. After these invited witnesses speak, we're going to call up witnesses from Group 1 in panel of 6. The first 6 witnesses will be Mark Enochoff, Art Stretton, Suzanne Castillo, Ken Roberts, Rachel Malone, and Brian Jackson. And I want to reiterate that it is my intent to hear from as many members of the public as possible. At latest count, we have received 379 witness cards from individuals who wish to provide oral testimony. There are 1,700 people in line. At 2 minutes each from those 379, that's about 13 hours of public testimony still ahead of us. The line is growing, but I will remind you that at 11 o'clock we cease to accept cards from individuals who wish to provide oral testimony. The rest will be registered either as in favor of or in opposition, but not testifying or written testimony, or both. So, having said that, I'm going to...
Madam Chair.
Are those lights on? Wow. Okay. Stop right there. Stay where you are. I didn't even notice who was first. Senator West.
Just one question.
Sure.
All right. You said you were going to cease, if you hadn't registered by 11 o'clock, you could not provide oral testimony.
That is correct. You weren't here when I laid out.
I was listening to you.
You were listening?
In terms of the individuals that are in line right now.
Right.
That were in line by 11 a.m.
Will they be
allowed to finish? So you're cutting the line off at 11.
Right. At some point we have to say no more oral testimony, but the line can continue till this meeting stops for people who want to register a position or terminate.
No, maybe you misunderstood my question then. If someone was in line at 11 a.m.
They testify.
They get an opportunity to testify.
That's right.
Okay.
That's right. Senator Zeffirey?
Yes. Would you give us the full ID of the persons who comprise this panel?
Sure. Well, I was going to ask them to, but I'll be happy to do that. Senator Urisky, you had a question?
I haven't finished. I have a couple of more questions. And then second, how were these 4 individuals selected?
I asked Senator Hager. I told him that I wanted to lay the groundwork, if you will, and to provide the names of 2 people in favor of the bill, 2 people in opposition of the bill, that would be able to provide us with some expert, if you will, testimony. There are hundreds of people that we could have had, but I wanted to at least start out with a smooth, here's some for, here's some against.
All right. And then my third question is, earlier you mentioned some resource witnesses.
Yes.
When will we be able to hear from the resource witnesses?
Well, they are only resource if there are questions of those resource witnesses.
Okay.
I will do that after we hear from public testimony. I want to respect the people that are out there in line who've been here for hours.
All right, because I will have some questions for the resource witnesses.
That's fine.
Thank you, Madam Chair.
Thank you, Richard.
Thank you, Madam Chair. Just quickly, for those members or individuals rather, that for whatever reason couldn't be here today to testify either for or against, would they be able to submit written testimony?
Sure.
Okay, electronically? Via email?
Well, okay. We can only accept written testimony for the registry. We've got to have time to enter all that. Is there a reasonable time limit? We're going to have to at some point cut off people who want to be shown as a position. I'm gonna wait to announce that, but I will accept and distribute to members of this committee written testimony till the special session's over. In order to be entered into the record electronically, I'm going to have to, let's see. Okay, yeah, I'm not sure what that time would be to be publicly acknowledged in the register. In fact, I think our rules say you have to be here to be in the registry. So let me just say definitively, I will make sure that every member of this committee gets any written testimony that's sent to us.
Well,
can't promise it'll be in the registry.
And my last question, Madam Chair, when we have the witnesses that come up either for or against, could we ask them to at least tell us where they're from, whether they're from San Antonio or Dallas? It'd be nice to know if they're from our district
Okay.
or what part of Texas.
Okay.
Thank you very much.
That's a good idea.
Or outside of Texas.
Yeah. In fact, in order, I will tell members of this committee, I'm planning to roll once we start with all of the people who are here. We don't need to ask each person to identify yourself and tell who you are and who you represent. I'm just telling you right now, when you come before us, identify yourself and tell who you are, who you represent, where you're from, and so we can roll for all these people who are standing out there, okay? Okay. Any other questions? And you heard the request from Senator Zaffirini. When you identify yourself for the record, I would like for you to say who you represent and what your area of expertise is. We're going to start with Ms. Miller. Go ahead.
Madam Chairwoman and honorable committee members, thank you for inviting me as a witness for the hearing today. I appreciate the opportunity to lend my expertise to the committee, and I invite your questions. My name is Amy Hagstrom Miller, and I oppose these bills. I am the president and CEO of Whole Woman's Health. We operate 5 licensed abortion facilities and 1 ambulatory surgical center in the state of Texas. In my testimony today, I will address 4 main issues. 1, there is no safety problem related to abortion care in the state of Texas. 2, the existing abortion facility regulations are rigorously enforced and are sufficient to ensure the health and safety of women in Texas. 3, medication abortion is safely offered in clinic settings and falls completely outside the scope of practice for an ambulatory surgical center. 4, requiring physicians to have admitting privileges is not equally enforced over other medical specialties, nor is it necessary to ensure the health and safety of Texas women seeking abortion care. We have over 40 years of safe abortion on record in Texas, and the current regulatory system is more than adequate to ensure women's health. Abortion facilities in Texas are licensed, inspected, and highly regulated. We operate safe facilities all over the state, and the ASC requirements will not improve care, but rather reduce access for women in Texas and put more women at risk for later-term abortions or for illicit abortions outside the medical community. Ambulatory surgical center regulations are primarily related to the physical plant, and they do not make abortion any safer. While abortion is ethically, emotionally, and spiritually complex for many people, the fact is that it is medically very simple. Abortion takes 5 or 10 minutes. It's done under local anesthesia. Women get dressed and can walk on their own to the recovery room. There is no incision and an extremely low risk of infection. There's no need for the larger operating room, the wide hallways, the additional airflow system, the regulated humidity, the locker room showers, and janitor's closets in an ASC. This bill also puts forward a radical restriction for the abortion pill, a simple set of medications women take to induce an abortion, usually before there is even a fetus. This bill would require that medication abortion be offered only at surgical center and that the women be required to come in for no less than 4 face-to-face visits with the physician in order to take the pill. This is totally uncalled for medically. Finally, I wish to address the requirement for all physicians providing abortion care to have admitting privileges at a hospital within 30 miles of the ASC. Abortion is one of the safest procedures in medicine. It is 16 times safer than full-term childbirth, and with a complication rate of 0.05%. Abortion providers rarely have transfers or admissions into hospitals for their patients. The current system we have for abortion facilities in Texas works very well and ensures safety for the women we serve. No other physician providing day surgery at an ASC is required to have admitting privileges: the ophthalmologist, the orthopedist, the gynecologist. The current ASC regulations require physicians to have privileges or have a transfer agreement with a local hospital. This system works to care for women seen in ASCs for a variety of surgeries across specialties. In conclusion, let me remind you that abortion didn't start with Roe v. Wade. Safe abortion started with Roe v. Wade. If these restrictions pass, thousands of Texas women will be without proper care. I strongly oppose the passing of these bills, and thank you again for inviting me here today.
Thank you, and thank you for coming.
I've shared quite a bit of information with you all.
Lots of reading material.
Yeah, one of the pieces of information I want to point out is the inspection tool that the surveyors use when they come to inspect abortion facilities in Texas. It's the thickest document that I gave you. Yeah, that's the survey tool that the inspectors go through with every abortion facility unannounced annually across the state of Texas. There's also some published research I sent you about illicit border crossing for abortion and women who use Cytotec in the Rio Grande Valley outside the medical mainstream. You've also got some information there about women who are turned away for abortion services and what happens to them over time. And then I just simplified the difference between the ASC and the abortion facility regulations for you in a side-by-side comparison.
Thank you.
You're welcome.
Senator Zaffirini, are you entertaining questions for this witness at this time?
Well, yes, I will, but I will remind you that there are 2,000 people standing out there, so I'll ask everybody to keep their questions brief if you have questions. Go ahead, Senator Zaffirini.
Thank you, Madam Chair. Ma'am, one of the pieces of evidence that you gave us is this comparison. of the requirements for licensed abortion facilities versus ambulatory surgical centers. And let me make sure that I understand this correctly. You have the list of requirements for licensed abortion facilities on the left. Now, for ambulatory surgical centers, they're required to meet all of those standards plus the ones on the right.
Yes, you're correct.
And so this bill would add those on the right to licensed abortion facilities.
You're correct.
Is that correct?
Yes.
So basically, the first area is pertinent to physical plant requirements. Is there any reason that a licensed abortion facility would need to meet standards related to an increased surgery room size, an increased hallway width, male and female locker rooms, janitor closets?
You know, ambulatory surgical centers were developed in the 1990s as a cost-saving measure for Medicare and Medicaid, and when the healthcare system went, to HMO and PPO. And they're basically designed for outpatient surgery that's relatively complex, that usually might involve, a couple of different physicians in the operating room at the same time, along with the anesthesiologist, say a knee surgery or cataract surgery or something that's relatively complex. Most of the patients in an ambulatory surgical center would be asleep, thereby needing to travel down the hallway in a stretcher. And so, hence the airflow system. You've got an incision, you've got a woman or a man cut open on the table with pretty moderately complex surgery. That complexity makes a lot of sense for outpatient surgery in those specialties. Like I said, for abortion care, there is no incision. The procedure takes 5 or 10 minutes. A woman is not put to sleep with general anesthesia. She doesn't need to travel from the operating room down the hallway into the aftercare room. And so the physical plant requirements don't do anything to change the safety of abortion procedure. The abortion procedure itself is done the same way in an abortion facility as it would be done in an ambulatory surgical center.
Is there any reason that a licensed abortion facility would need a male locker room?
No. There's male physicians, there's male staff, there's women physicians, women staff. The locker room specifically, is set up for surgery where the doctors may need to shower, they may need to change. They've been in the operating room for 3 or 4 hours and need to change their scrubs. Abortion is not one of those kind of surgeries.
Now, the ambulatory surgical centers are required to have 3 or more nurses on staff, but licensed abortion facilities are not.
Licensed abortion facilities are required to have at least 1 nurse on staff.
1, but not 3.
Yes.
Is there any reason that they should be required to have 3 or more as the ambulatory surgical?
I believe that the ambulatory surgical center regulations are set up assuming that the vast majority of patients in an ASC setting would be post-anesthesia, and they would be in what's called PACU, the post-anesthesia care unit, where the RN to patient ratio is much higher because a woman or a man is coming out of anesthesia and needs a different level of monitoring than you do when you're ambulatory and completely lucid.
The ambulatory surgical centers also have to meet certain standards regarding non-physical plants. For example, the environment of care tracking logs, grounds inspection logs, hazardous material waste inventory, and some risk management patient safety logs, such as regarding patient burns and visitors' injuries. Is there any reason that those standards regarding non-physical plant, environment of care tracking logs, and risk management patient safety logs should be applicable to licensed abortion facilities?
Those regulations, like I said, in my ambulatory surgical center in San Antonio, we comply with all of those, but not very many of them are applicable for abortion care. And so, it's mostly more staffing, more paperwork, that kind of thing. They're not directly related to increasing the safety standards of the abortion-specific procedure. It could be argued either way, whether or not you could add some of those things and whether they would add safety to the procedure itself. The burn, for example, the burn log is for if you're doing cryosurgery or cauterization, which wouldn't be done in a facility that's doing abortion care, for example. So some of those things, there's certain, clarification where you have to say what site are you going into. When you're doing knee surgery, you have to clarify which knee you're going into, and you have to call it out loud, and you have to log that in the operating room. Some of those things aren't really applicable for abortion services.
Looking at this particular list, is there any requirement that is pertinent to the ambulatory surgical center, your column on the right, that would increase the safety of the women who go to licensed abortion facilities?
The abortion facility licensing regulations that we already comply with, like I said, are very rigorous and very onerous, and they're very specific to to abortion care. And so in my opinion, they're actually much more effective to be sure that the abortion facility is regulated according to the specialty in OBGYN that we are. And the ambulatory surgical center regulations are much more generic. They're not necessarily higher standards, they're different standards, and they're set up for different kinds of surgery within the medical specialty and the medical community, whereas abortion facility regulations are very specific to the nature of the service that we provide. They're about our quality assurance program, our infection control program. They're specific to the kinds of medications that we use and the kind of emergencies that we may encounter in abortion care, whereas ambulatory surgical center are much more broad, they're much more generic and not necessarily as specific to abortion care.
And I understand that, but my question is specifically, is there anything in the column on the right that would increase the safety of the women who go to licensed abortion facilities and are already protected by the requirements in the column on the left?
In my opinion, there is not. And we haven't noticed any increased safety when we compare the same procedures that we offer in our ambulatory surgical center to our abortion facility.
Thank you. Where are you from, ma'am?
I live here in Austin.
In Austin, Texas.
Yes.
Thank you very much. Thank you, Madam Chair.